Welcome to the deep dive. Ever thought about how your body's plumbing, its blood supply, could take a strange detour?
Hey, it's pretty fascinating stuff.
Yeah, today we're diving into subclavian steal syndrome. It's this condition where blood flow gets, well, rerouted, and it can cause some really surprising symptoms.
Exactly. So our mission, using your revision notes, is basically to unpack this. We want to understand what it is, why it happens, how you might spot it, and what can be done. The key facts for a quick recall.
Perfect. Okay, so subclavian steal syndrome. The core idea is blood flowing backwards,
Yeah.
right? Where exactly and what starts that process?
Yeah, so we're talking about reversed flow, usually in the vertebral artery, sometimes the internal thoracic, coming off the subclavian artery on one side. And the trigger, it's almost always a narrowing or blockage stenosis in the subclavian artery itself, the part closer to the aorta, the proximal part.
Right, proximal. So a blockage way up near the chest impacts blood flow, potentially to the brain.
Mm.
How does that link work?
Well, think about it. If that subclavian artery is narrowed, the arm on that side doesn't get enough blood, particularly when it's working hard, like during exercise.
Okay.
So the body has this slightly unhelpful compensation mechanism. It starts pulling blood down from the brain via the vertebral artery to supply that needy arm. The arm is essentially stealing blood meant for the brain.
Stealing,
Yeah.
hence the name. Okay. But, the notes mention that arm symptoms, like pain during use, are often more common than brain symptoms. Why is that?
That's a really key point. Often, the brain has a backup supply. The vertebral artery on the other side, plus the circle of Willis, can usually compensate pretty well.
The collateral circulation.
Exactly. So the brain might be getting just enough blood, avoiding major neurological issues most of the time. But the arm, being downstream from that blockage, directly feels the pinch during exertion. That's the claudication pain or weakness.
So that difference is important. Syndrome means symptoms are present.
Right. While the reverse flow itself, even without symptoms, is called the subclavian steal phenomenon, or SSP, it might just be an incidental finding.
Got it. And it tends to happen more on the left side.
Yes, about a 3 or 4 to 1 ratio, left versus right, mostly due to the sharper angle the left subclavian takes off the aorta, although, interestingly, some people have a variation where the left vertebral artery comes directly off the aorta.
Oh.
And in those cases, this kind of steal is basically impossible on that side.
Fascinating. So what's usually causing that initial narrowing, the stenosis?
The main culprit, far and away, is atherosclerosis. That hardening and narrowing of arteries from plaque buildup. Same stuff that causes heart attacks and strokes.
Right, the usual suspect, yeah.
Less commonly, you might see it caused by arteritis, that's inflammation of the artery walls, or maybe some congenital issues people are born with.
Okay, so atherosclerosis is number one. Who's most at risk then? Does it follow the same pattern?
Absolutely. The risk factors line up pretty closely with general cardiovascular risks. So we're looking at older age, definitely smoking,
Always smoking.
always. High blood pressure, diabetes, high cholesterol, hyperlipidemia, and of course, a family history of vascular problems.
Makes sense. Any less common things to be aware of?
Yeah, a few. Things like thoracic outlet syndrome, where vessels get squashed near the collarbone.
Okay.
Sometimes it can be a complication after certain types of heart surgery, like for aortic coarctation or tetralogy of Fallot, if a specific shunt, the Blalock-Taussig shunt, was used. And then there's Takayasu's arteritis, an inflammatory disease, which is seen more often in Asia.
Right. So let's just recap the mechanism, the actual steal. Artery narrows, arm works hard, needs more blood.
And because the direct route is blocked, the pressure difference pulls blood backwards down the vertebral artery from the brain supply.
Got it. And that backward flow, that's what causes the temporary drop in brain blood supply, cerebral hypoperfusion.
Precisely, especially affecting the back part of the brain, the vertebrobasilar system. That's why you get those specific neurological symptoms when it happens.
Okay. Now, this is important for exams, I guess. If someone comes in with these symptoms, arm issues, maybe some dizziness, what else needs to be on the list? The differential diagnosis?
Oh, definitely. It's a broad list because the symptoms can overlap. You'd think about major vessel issues like aortic dissection or inflammatory conditions like giant cell arteritis or Takayasu's again,
Okay.
general atherosclerosis elsewhere, maybe a clot, a thromboembolism. Then brain-specific things, is it something like MS or even a tumor in the cerebellum?
Wow, okay.
And don't forget structural things around the neck and shoulder, thoracic outlet syndrome, a pinched nerve in the neck, cervical radiculopathy, or even a brachial plexus injury, and of course, peripheral artery disease in other limbs.
That's quite a differential. Need to rule those out. How common is this condition actually, say in the UK?
Good question. Precise UK prevalence isn't perfectly pinned down, but generally it's considered pretty rare. Overall, adult incidence is maybe somewhere between 0.1% and 3.4%.
So not common.
Not common as a syndrome. But interestingly, if you look at people who already have peripheral arterial disease, maybe up to 30% might have some degree of subclavian artery stenosis.
But not the symptoms.
Often not, because they've developed those collateral vessels over time, compensating for the blockage. So stenosis is more common than the symptomatic Steal syndrome itself.
Okay, that makes sense. Let's talk presentation then. What are the absolute key symptoms and signs someone should look for or a doctor might find?
Right, symptoms first. The number one for the phenomenon is arm claudication, that arm pain or weakness with use. But for the syndrome, you're looking for those neurological signs tied to reduced blood flow at the back of the brain.
Like
Dizziness, vertigo, visual problems blurring, double vision, temporary loss of vision, sometimes fainting, syncope, though that's less common. And crucially, these often get worse during or right after using the affected arm.
Okay, so arm exercise is a trigger.
It's a classic trigger. You might also see coordination problems, ataxia, slurred speech, maybe tingling or numbness, face, body, limbs, temporary weakness in a limb. The arm might feel cool or have pins and needles. Rarely, you might see drop attacks, tinnitus, or hearing loss.
Quite a range. And what about signs a doctor might pick up on examination?
The big one is a blood pressure difference between the arms. A drop of more than 15 mmHg in the systolic pressure on the affected side compared to the other arm is highly suggestive. Even 10 mmHg difference is noteworthy.
Okay, measure both arms.
Definitely. You might also find weakened or even absent pulses at the wrist, the radial and ulnar pulses, especially if you check while the patient raises the affected arm. And sometimes you can hear a whooshing sound, a bruit over the subclavian artery with the stethoscope.
Got it. So if you suspect it based on all that, how do you confirm it? What are the go-to diagnostic tests?
The first step is usually a Doppler ultrasound. It's non-invasive, uses sound waves to check blood flow direction and speed, and can often spot the stenosis and the reversed flow in the vertebral artery.
So ultrasound first.
Usually, yes. Then for confirmation and to see the anatomy clearly, like how bad the narrowing is and exactly where you'd move to angiography. This could be traditional catheter angiography, but more often now it's CT angiography, CTA, or MR angiography, MRA.
And they're looking for
that stenosis in the subclavian artery, and critically, that retrograde, that backward flow in the vertebral artery on the same side. That's the clincher.
Right. The notes mention duplex ultrasound and transcranial Doppler are actually better for seeing the flow reversal itself.
Yes, they can be more sensitive specifically for detecting the direction of flow compared to standard angiography, which is more about visualizing the structure. You might also do a standard CT or MRI of the brain to rule out those other neurological causes we mentioned. Maybe a chest X-ray too, to look for external compression.
Okay, comprehensive workup. So once it's diagnosed, what's the plan? How is subclavian Steal syndrome managed?
Well, if the symptoms are mild or infrequent, the first approach might just be conservative management. Focus on lifestyle, like stopping smoking, absolutely critical. Controlling blood pressure, managing diabetes if it's present, lowering cholesterol, basically tackling that underlying atherosclerosis. Medications like antiplatelets, maybe statins, ACE inhibitors, beta blockers might be used too.
And if conservative management isn't enough or symptoms are severe,
then you look at intervention to fix the blockage. The preferred methods these days are usually percutaneous, meaning done via catheters through the skin. So, angioplasty, where a balloon is inflated to open the artery, often followed by placing a stent, a small mesh tube, to keep it open.
Angioplasty and stenting.
Yeah.
Less invasive.
Exactly. They generally have really high success rates, technically speaking, and the stents tend to stay open well long term, especially useful for patients who might be higher risk for open surgery.
Are there still open surgical options?
Yes, though less common now. Things like a carotid subclavian bypass, using a graft tube to reroute blood around the blockage, or a transposition where the subclavian artery is actually moved and reattached to the nearby carotid artery.
Okay, so what's the overall outlook, the prognosis for someone with this?
Generally, it's pretty good, especially if it's treated. The prognosis really hinges on how severe the stenosis was and how well the collateral circulation was compensating, or how well the intervention works. Managing the underlying cardiovascular risks is key for long-term health.
So treatment usually helps the symptoms.
Oh, yes. Symptom improvement is common after successful revascularization opening up that artery. If they can restore normal forward flow in the vertebral artery, the outcome is often excellent. But, of course, other health problems or very advanced disease can affect things.
Are there potential complications down the line?
The main risks are related to ischemia, lack of blood flow. So, a stroke or further problems in the arm, these might need more interventions. And it is important to remember having subclavian stenosis itself, even if treated, is a marker for increased cardiovascular risk overall. It signals underlying atherosclerosis.
That's a crucial point. It's a sign of wider issues.
Absolutely. And just briefly, there are related but much rarer steal syndromes like coronary subclavian steal affecting heart bypass grafts and spinal artery steal syndrome. Same principle, different location.
Right. Okay, so to wrap up, subclavian steal syndrome, it's this unusual situation where blood flows backwards from the brain supply to feed the arm, usually because of a blockage, mainly atherosclerosis.
Yeah, look for that combo of arm symptoms, especially with exercise, and neurological signs like dizziness or visual changes.
Diagnosis relies on imaging, particularly ultrasound and angiography, to see that reverse flow. And treatment ranges from managing risk factors to angioplasty and stenting.
That sums it up well. It's a great example of how interconnected everything is in the circulatory system.
It really is. Which does make you think. Considering how complex it all is, what other seemingly localized problems in the body might actually be causing ripple effects we don't immediately suspect? Something to ponder.
Definitely food for thought.
And for anyone wanting to dive deeper or revise this topic further, remember to check out pastthemsra.com and also freemsra.com for more resources.